Welcome everyone to another episode here at Doctors of Podiatry. Love it. Today we have a very interesting case. We have a young patient who about a month ago sustained an injury. The patient rolled her ankle. The patient presented to our office, examined the ankle, x-rays were non-contributory, and we decided to get an MRI. The MRI revealed several important things. Anatomy 101. The ankle joint is made up of 3 bones. We have the fibula, we have the tibia, and we have the talus. 3 bones. On the side of the ankle, the fibula, right, we have 3 very important ligaments that hold the ankle in the rectus position, the normal position. If these ligaments are or become damaged, there's a very good possibility or probability that the ankle wants to or will give out. Several days ago, the patient re-rolled her ankle. So not only did she have the original injury, then she re-injured it again. The MRI revealed, let's go over here now, fibula, we have 3 ligaments, anterior talofibular ligament, the calcaneofibular, and the posterior talofibular. The patient had sustained a high-grade tear of this one and this one, partial tear. So these 2 ligaments were damaged. In addition to this, in the talus, right, this is the talus, the tibia, the fibula, the patient sustained what we call an osteochondral fracture, okay? Kind of like a compression fracture. And the problem with these little fractures, because this is a weight-bearing joint, long-term, it could cause what we call post-traumatic arthritis or inflammation in the joint. The good news is that little fracture stayed in its place. It did not pop out, right? This is kind of like the schematic diagram. It's not floating in the joint. That could be really bad because sometimes we need to go in there and remove it. I spoke to the patient in great length concerning all the treatments available at this time, including but not limited to physical therapy, immobilization. We spoke about a lot of other treatments, but in my experience, when you have these injuries of the lateral ankle ligaments, I like to be very aggressive because I want to prevent something that's called a chronic lateral ankle instability. It's a very uncomfortable feeling that patients that do not treat these injuries correctly may end up with, and that's a feeling that the ankle will always want to give out on you. Can you imagine how uncomfortable that could be? So you're walking in and you're sort of like, you're not 100%. So what I recommended is that we implement PRP therapy, injection in several places. I'll show you guys now. PRP, acronym for platelet-rich plasma, platelets. The PRP, again, the plasma contains the platelets, which contain growth factors and important cells that aid in regenerating the damaged tissue, right? In this case, the damaged tissue, and also to reduce inflammation. That's the Cliff Note version of what it does. And in addition to that, I decided to, let's go ahead and, this is the needle, right? Well, let's inject a little bit of PRP also in the ankle joint to do the same. Help it heal. Just come around here. We already demarcated all the areas with the ultrasound. And again, we injected the PTF, CF, and the ATF. And I'm gonna go ahead and just so everyone can actually get a better idea here, right? We're gonna go ahead and finish off here, right? I like to inject very slow, just like that. And this is actually the second syringe, so that'll be definitely enough there. And we already, okay, if you guys can see here, we already also injected the ankle joint. Okay? PRP is an alternative. PRP is not a first-line treatment for several clinical presentations. It is very important for the public to understand that it is a physiological process, which means it's not a miracle injection. It takes time for PRP to do what it needs to do. Okay? So if anyone has any questions, again, whether it's this injury, like I've said before, plantar fasciitis, heel pain, Achilles tendonitis, any tendonitis of any tendon, fractures, we pretty much use it for anything, wound healing, ulcerations, chronic ulcerations, you name it, we use it. Our job here at Jaws Podiatry is to heal patients. So whatever we need to do, right, that's exactly what we do. And we have all the tools in the toolbox to be able to deliver that to patients. Like always, I thank everyone for watching. You can follow us on our platforms, www.jawspodiatry.com, Facebook, Jaws Podiatry, Instagram, Dr. Toe Jam, and finally our YouTube channel. I'm loving that YouTube channel. We're getting a lot of great traction from just people from all over the world just interacting with our organization. If you're not subscribed, please do so. Like always, thank you for watching.